Good afternoon, everyone. Alisa, Haushalter, Director of the Shelby County Health Department. On behalf of Mayor Harris and Mayor Strickland, I want to welcome you to the Memphis and Shelby County Joint Task Force update. Before we give the data updates and then provide some additional information on our actions moving forward, we have a special guest with us today. Commissioner Willie Brooks, who's with Commission District 6, is here to share some things that he's focused on in relation to the COVID pandemic and his desire to help our community deal with legal issues relative to the pandemic. So I'm going to turn it over to Commissioner Brooks. After he says a few words, I'll come back and give the data update. Commissioner Brooks.
Thank you, Dr. Haushalter, and good afternoon. As a stopgap measure to prevent homelessness caused by the COVID-19, I sponsored a resolution appropriating funds in amount of $50,000 to Memphis Area Legal Services headed by Cindy Ergoff to provide eviction relief and to assist tenants facing eviction with legal counsel in hoping of preventing the tenants from being removed from their homes if there is a COVID-19 hardship, such as personal illness or financial hardship and layoff. Memphis Area Legal Service will use this funding for tenants residing in District 6, which include Raleigh, Frazier, and Nutbush. As a compassionate leader for the residents in Raleigh, Frazier, and Nutbush, a check has already been provided in an amount of $50,000 for the Memphis Area Legal Service to be utilized for combating eviction of tenants with COVID-19 hardships, those who are experiencing financial hardships due to pandemic or having tested positive for COVID-19. Memphis Area Legal Services will use this funding for those tenants residing in my district, again, which includes Raleigh, Frazier, and Nutbush. Two of the areas in District 6 rank 3rd and 4th in terms of poverty in the Memphis area, with the last pre-COVID estimate of individuals living in poverty in those areas being about 43%. For Frazier, well over 16,000 rental units are there located. Almost 30% of the households in Frazier are single-parent households headed by women. Even in job loss due to COVID-19 were not involved, the inability to leave children to go to work is now a tremendous factor in the ability to earn wages. And for those in Raleigh, rental-occupied real estate is dominated in the Raleigh neighborhood at an estimate of 86%. So what we're trying to do is address those challenges that are being faced by people who have been furloughed, to prevent the virus from being spread for those who might have been laid off, and to prevent homelessness in the Memphis and Shelby County area. In order to receive the services, call 432-HOME or 432-4663. Tell them that you're calling about District 6 eviction relief, and their cases will be assessed for eviction prevention assistance from the allocated District 6 funds. Again, call 432-4663 and let them know that you're calling regarding District 6 eviction relief funds. Thank you very much.
Thank you, Commissioner Brooks, for your leadership and, as you said, compassion. It's really critical that we have compassionate leaders, so I appreciate that. I'm going to provide some data updates, and Dr. Randolph will give some additional updates on our consideration of our upcoming health directive. And I will apologize up front. I did have some slides and didn't prepare them in the right format, so if you'll bear with me, because generally on Thursdays we do give quite a bit of updates, a little bit more than on Tuesday. So as of today, we have 31,643 cases. That's an increase of 103 from yesterday. So we're staying very steady at our day-to-day increases, and we're continuing to trend downward over a period of time. So that's positive. We do know we have ongoing transmission, but we do know that that transmission is going down. Our transmission rate is back below 1, which is the magical number that everyone knows we're looking for, so that's positive as well. As of this morning, unfortunately though, we have continued to have increase in deaths. And so we do know at the current time, and I want to make sure I have that right number in front of me, it's close to 500 deaths, and I apologize, I don't have that with me this afternoon. We also want to make sure that we're pointing out that we continue to have increased transmission amongst the younger age group, particularly those 25 to 45. So our messages really hone in on that age group. We know that that age group is less likely to have severe complications, but very likely to be able to transmit to others who will experience severe complications and potentially death. There's been some new data that's released nationally about the role that children play in transmission. We do know that children do have the ability to transmit to other children as well as adults, and so it's important that we reduce transmission in all age groups, in part because we now are very clear that children do have the ability to transmit, which is not necessarily the message that we had been receiving previously. We continue to have higher rates of COVID amongst communities of color, and so for those cases in Shelby County, almost 60% are amongst African American communities and about 22% in the Caucasian community. 20% are listed as other, and we have very little that at the current time are not listing race. And for the Latino or Hispanic community, about 20% of our cases are amongst that community. We're continuing to post information on our pediatric cases, and so encourage you to go to Shelby TN Health for more detail in that particular area. But I think for many of you who tuned in today, your interest is probably where do we go from here, as well as where do we go from here in Shelby County, based on the information that came out of the governor's office this week. So I want to just remind everybody that the 6 metros in the state of Tennessee, of which Shelby County is the largest metro, have independent authority to issue mask ordinances and health directives at the local level. That's historic, and the reason for that is because what happens in an urban community that has the population that we have here in Shelby County, or say Nashville, Knox County, and so on, really is quite different than what may happen in a rural community. And it's important that the local metros have the ability to act quickly when there is any threat to the public's health. And so that's why we've historically had that level of autonomy. We will continue to use data to drive our decision making locally, and we will continue to look at those 4 gating criteria. The scope of the pandemic, and that particularly will look at number of new cases per day, the trend upward or downward over a period of 2 weeks. We will continue to look at positivity rate, reproductive rate, and duplication rate. We will also look at the gating criteria relative to hospital capacity and whether or not we are able to absorb any increase in the number of cases that we may experience, so that people can receive care if they need it for COVID, but also that they can receive care that they may need for other health issues. We'll continue to look at testing capacity, and we'll continue to look at public health capacity. At the current time, we are actually doing very well in all of those areas. Health Directive 12 reduced some of the restrictions that we had previously, and Dr. Randolph's going to speak to this more, but we are looking at the restrictions that we will or will not have in Health Directive 13, which we anticipate releasing early part of next week. What we want to do is make sure that we are continuing to be very laser focused on the areas of where and when transmission is occurring. So we will continue to use data, but we're also collecting much more detail from the case investigations to determine where we know transmission is occurring, not limited to healthcare settings in schools, but other locations. So that will help us really reduce those community-wide policies so that we can be, again, very laser focused. We'll continue to focus very heavily on contact tracing, but I also want to point out that it's critical that individuals continue to take actions not only to prevent the spread of COVID, but also to remain healthy throughout the year, and particularly as we go into fall and winter. So we've really stressed the critical need for getting your flu vaccine this year. Vaccine is available in a lot of places already, The health department has pediatric vaccine in its clinics. Our adult vaccine will be here soon. We will be partnering with some of our community safety net partners to make sure that we have vaccine readily available to the Shelby County community. So get your flu vaccine. I've also heard from a lot of people that they've postponed their regular annual physicals, or they've postponed their maintenance or follow-up visits with their healthcare provider because of COVID. Most healthcare providers have implemented a variety of tactics to make sure that there's not spread of transmission in their offices and clinics. So I really encourage you to reach out to your provider, schedule your regular appointment, and keep that appointment and use the policies and practices that your provider has in place. Some of them may do it by telemedicine. Some of them have you wait in the car until it's time for your appointment. But please don't delay your regular appointments. And also, I always reinforce the importance of healthy eating and active living and using that as a method to stay healthy. But then I'll reinforce those key things that we have been highlighting throughout the pandemic. It's really important that we all continue to wear our masks when we are not only in public settings, but when we're around individuals who are not from our household. So in the workplace, out in public settings, if you go to visit somebody that's not from your household, wear your mask. The other is to continue to social distance, and that's 6 feet or more. Hand washing, as a nurse, I always highlight hand washing is actually your first defense in reducing the spread of any disease. So good hand washing is critical. And for those who have chronic diseases, particularly making really solid decisions about when to travel and where to travel so that you reduce the likelihood of exposure. We know we're going into fall break time for school, and this is a time that many people do travel. So I do ask people to really think about their travel and what they will or will not do while traveling and how they put things in place to reduce transmission when they're traveling. An example is you may have one mask you use during the day, but if you're traveling, you really need to take multiple masks and have those available, have plenty of hand washing materials, and so on. So I'm going to pause there, turn it over to Dr. Randolph, and then we'll open it up to questions.
Thank you, Dr. Haushalter, Commissioner Brooks. Greetings, fellow citizens of Shelby County. This is Dr. Bruce Randolph, Health Officer of Shelby County Health Department. I'd like to just spend a few moments to address some of the questions that have come up as it relates to the health directive. As many of you are aware, that the governor issued an executive order that removed some of the restrictions for businesses and services in the 89 counties. However, he left in place the authority of the 6 independent county health departments, in which Shelby County is one, to continue with its present health directive. Of course, our desire and goal is to try to align things with the executive order as much as possible, however, based on our given situation locally, based on the data that we have locally. So as it pertains to the Health Directive number 13, that should be issued sometime next week. We will continue to monitor the data for the remainder of this week to ensure that the downward trends continue and we continue to have progress in a positive way. But if all is well, next week sometime we will issue the Health Directive number 13. In this new directive, the things that Dr. Haushalter mentioned in terms of safety measures, the wearing of the face mask, social distancing, hand washing, the testing, case investigation, all of those measures will be emphasized and re-emphasized and enforced in the new health directive. Services and businesses will be open except for those that have been identified as being closed in Health Directive number 12. However, things aren't going back to the way they were before the pandemic or before we closed. Businesses, services, and individuals will still have to adhere to the safety measures that we have in place, such as seating in restaurants, whether you're full service or limited service, any other type of similar facility or establishment. You still be expected to sit in order to order alcohol. The bar area would still remain closed. Dancing would still be restricted for inside. In terms of capacity, we've already removed capacity. The number of people allowed within an establishment or facility at any one time is determined by the number of people that can be separated at a minimum of 6 feet. That is the basis of determining capacity, so to speak. The other important thing in the Health Directive 13 is that we will revise the indoor and outdoor seating capacity for sporting events. Currently it's at 12 feet. We are looking closely at our data to make some adjustments on that, and that will be revealed in our new directive. The thing I want to also point out, and Dr. Haushalter alluded to this, is that we're at a point now where we can become more laser focused as it relates to identifying cases, where these cases occurred, and subsequently responding accordingly. So, when we have cases and we can associate these cases with certain establishments, then it would be those establishments that we will investigate, educate, and if necessary, close. And that way we can be more specific. And so therefore I would encourage all establishments, facilities, venues to really make sure that you adhere to the safety measures in the Health Directive. Establish your operation manual and how you function based on these safety measures, because if we get the report that we have an outbreak at a particular establishment, we're going to come and we're going to investigate, and we will close that particular establishment if it is determined that safety measures are being violated. The other thing I want to emphasize again is that we encourage the citizens to participate in enforcement efforts. If you see a facility or establishment that's not adhering to the safety measures, notify us. Notify the owners of the establishment. Bring it to their attention so that people can do right, so that we can do more. And again, I would reemphasize, because things are opening up, doesn't necessarily mean that everyone should participate, visit, or go. You need to assess your own personal risk factors to determine if you should go or not. Because things are legally permissible, are not necessarily medically advisable. So use the wisdom that you have to act accordingly. With that, I will stop and entertain any questions that you may have.
Kendall Downing, WMC.
Good afternoon, everyone. My first question is regarding the governor's order and the authority of the health department, and it could be for Dr. Randolph or Dr. Haushalter. The Speaker of the House, through his spokesperson, has said that he will push for legislation next legislative session to remove the autonomy of the health departments in making these decisions. What is your reaction to that, and does it affect decision-making moving forward? And then I have a follow-up.
I'm going to address, and then I'm going to let Dr. Haushalter address. My position is that, we obey the law. And so currently the law gives us the authority that we have instituted, and therefore we will continue to do that. If the law changes, then we will act accordingly to what the law says. But currently, the actions that we have taken have been given to us through statute, and so that's what we have done. I'll let Dr. Haushalter come in.
Thank you, Dr. Randolph. I just want to add to that that I really ask people to think about the authority and why it's used in a time when there's not a pandemic. So I have said publicly many times, if public health does its job well, you really don't know that we exist in the community. We don't have big red fire engines. We don't have sirens on our vehicles. We don't even have uniforms. So you don't know that we're here, but you expect to have clean water. You expect to go into a restaurant and have healthy food. You expect to stay in a hotel and not become ill. You expect to be able to swim in a swimming pool and not be able to become ill. You expect to go to the workplace and not be exposed to things like tuberculosis and other illnesses that are outside the pandemic. What's happened is during the pandemic, our authority has become much more visible. And I do understand for many people there's a questioning of what our authority is and why we have it. But we actually use that authority each and every day outside of the pandemic to address issues in our community. An example that I will give is that we have had outbreaks of Legionella. That's associated with watering systems. If we have a Legionella outbreak, that really impacts our community because it's oftentimes tourists who are impacted by Legionella. And so we have to be able to quickly close a facility to reduce transmission of Legionella. We have individuals who have tuberculosis. We still have tuberculosis in our country. We still have it in our community. If an individual has active tuberculosis and continues to go out into the public and expose others, we have to be able to quickly direct that person to stop exposing the rest of the community. And so that tool is used on a daily basis, not just during the pandemic. So I really encourage people to think about that. As Dr. Randolph said, we will do whatever the law says that we're supposed to do, but I want people to really understand the role of public health and how we serve this community every day, not just during the pandemic, to reduce the transmission of disease. And you probably have a follow-up.
Yes, I do. Today there were 7 deaths reported. That seems like a pretty large number. There were 5 reported yesterday. Is there something going on or that could be contributing to those numbers?
No. What we're learning more and more about COVID is that there are individuals who can be ill for a very long time before they pass away. There are others who seem to recover and then get ill again. So I don't see any specific trends that are related to that increase in the number. I think it's also where we are in the pandemic and the length of time that we've had and the people who have been ill for an extended period of time.
Jenny DePrizio, Local 24.
Yeah, I have 2 questions. The first is regarding the potential change in seating capacity. Can you elaborate on that a bit more regarding sports events? Should we and fans look forward to possibly being allowed to have more people in the Liberty Bowl for the next home game?
So we'll continue to look at the data and make a more formal announcement next week. However, we actually announced previously that as we incrementally reduce restrictions, that we would first open the limited service restaurants and monitor that data for several weeks, and that the next thing we would look at would be seating capacity. A couple of things to think about is we had already lifted like the percentage capacity that businesses or locations had to adhere to, and the reason for that is that was set to help people really visualize and determine the number, but that wasn't necessarily the most effective strategy. The social distancing is the public health strategy. And so the second area we had to look at is what is the appropriate distancing. And if you recall, initially we had 18 feet indoors, then we went to 12, and so we will be looking at reducing that social distance amount in the next health directive.
And the follow-up is, what about restaurant hours? Are you looking at extending those hours past 10 o'clock?
So we'll look at restaurant hours. That's another thing that we previously said would be one of the next things that we look at based on several weeks of data. So yes, we'll be considering that as well.
Kirsten Garris, Fox 13.
Hey, can you all hear me?
Yes.
Okay, there we go. In the beginning of the presser, you mentioned how there's new research showing that children can transmit the virus to other children. How does this new research affect the possibility of reopening schools in Shelby County?
So really from our end, it doesn't change what we've been doing. The schools locally have put plans in place to reduce exposure, to try to quickly identify those who are cases and isolate and quarantine individuals. Shelby County Schools obviously is working on their plan for having in-classroom classes again. And so it's just knowledge to take into consideration, but I think locally we've actually done a pretty good job of already realizing that that's likely, that we knew children could transmit. So I think it just proves what we had already recognized locally. So I don't think it's going to change the plans much. The key will be, as we move forward, is identifying cases quickly. And so part of that is testing and really revisiting the role of testing that we have locally. We still have a lot of unutilized capacity. So people can get a test, they're not necessarily getting tested. And how do we potentially work with schools to do more testing so that we pick up those cases quickly, not just amongst children, but also amongst the teachers?
And then another follow-up, you also talked about how there's still high transmission with that 25 to 45-year-old age range. Do we know where that's coming from? Are these folks traveling? Are they getting it at restaurants? I mean, is there a way to pinpoint why the group is still high?
Yeah, so that's a great question. So I'll make a few comments and then tell you what we are working on. That's actually a very social age as well, and that's individuals who are out in the workforce. So some of it really just has to do with they're active in many different ways. I've said repeatedly that unfortunately the data collection system in the state of Tennessee had a lot of limitations at the beginning, and it was very difficult for us at the local level to pinpoint that transmission was occurring at a particular location, a restaurant, a house, so on. So we actually have added significant layers of data collection to our system so that we can better identify that information. That tool has been in the field now for a couple weeks, so I would say moving forward, we will be able to pinpoint much more